Okay, so let's talk about what the harm of het-cis norms are, particularly for our LGBTQ youth students in schools. Where LGBTQ refers to lesbian, gay, bisexual, transgender, and queer or questioning, which we're going to use as our all-encompassing term for youth with diverse sexual orientations and genders. Okay, so when we think of what the harms of het-cis norms are, it's first that what we assume where being heterosexual and cisgender is typical or normal, where that's automatically converted to what is normal or valued. But then the problem is that any identity that deviates from being heterosexual or being cisgender is then assumed to be strange, different, unworthy, and wrong. So even though there's nothing wrong with being straight or cisgender, it's the normed idea that being being heterosexual or cisgender is normal and valued and okay, and being anything else is not. It's problematic. So this is what the problem is, and we have to break ourselves of holding these values and expectations. So now let's look a little bit more into what the harms are and a theoretical foundation for where these harms are based. So this right here is an image that depicts the minority stress theory. Minority stress theory is a framework that posits that people who are not heterosexual or cisgender, so people with diverse sexual orientations or genders, experience additional stressors above and beyond their heterosexual cisgender peers. So for instance, we all experience job stress. We all experience having to pay bills every month. But not all of us experience discrimination or bigotry or harmful bullying because of our gender or sexual orientation. So this model here shows how being LGBTQ in and of itself is not a problem, but holding that identity leads to specific stressors where people are going to discriminate or are going to say hurtful things or do hurtful things, which then these experiences, not being LGBTQ, but these experiences, because of the norms that we're entrenched in, lead to exacerbated outcomes, such as increased anxiety, increased depression, increased suicidal ideation and follow through. But the question is, what can prevent these stressors from leading to exacerbated outcomes? And that's protective factors. Things like having social support, having people who care, having people in your life to say, don't listen to them. They're not worth it. We're the people who matter and we love you no matter what. So this is what the minority stress theory posits. It says that living with a minority identity is not in and of itself a problem, but other people who undervalue that identity may say harmful things or do harmful things, which then causes increased stressors and problematic outcomes, like anxiety, depression, and suicide. And ways that we can alleviate this are through those protective factors. So an example of what this looks like is if someone's gay or non-binary, they may hear someone say, that's so gay, like just saying that, which maybe the person isn't meaning to be harmful, but hearing that can be stressful, especially if someone's not out. So when hearing that and not being out, someone may have increased anxiety or worry around their safety and their acceptance by others. They may feel they cannot speak up because they're not out, and they may then avoid events, programming that person, which can then remove them from opportunities to advance in life or to connect with others. So this would be less of a worry if that person has protective factors of having friends outside of school or people they can count on after hearing this harmful thing to say, can you believe someone said that? So that's the benefit of the protective factor when people who are LGBTQ are hearing these stressful experiences and possibly developing negative outcomes as a result. So what do these stressors look like? So this is data from stopbullying.gov. And when we think of this minority stress theory right here, we're looking at what are examples of stressors. So that's what we're going to look at over these next two slides. So for instance, in a sample of LGBTQ youth, 82% endorsed having problems during the previous year with bullying about their sexual orientation. 44% reported feeling unsafe at school due to their gender identification. 44% endorsed experiencing physical harm or harassment. 32% did not get to go to school for at least one day because of feeling unsafe. 64% felt unsafe at school due to their sexual orientation. 31% said that school made no effort to respond to those that did not report their attacks of bullying. 61% of youth never reported attacks of bullying, and 22% experienced strong violence. So this shows some of the statistics that indicate a majority of LGBTQ youth are experiencing problematic stressors that their heterosexual cisgender peers are not. So when we think of bullying, we see that 8 out of 10 students have been verbally harassed, and 4 out of 10 who are LGBTQ have been physically harassed at school. When we think of sexual minority youth, so youth with diverse sexual orientations, we see that they develop increased problematic exposure to smoking, dating violence, and suicide attempts. We also see that 71.3% of LGBT youth have heard homophobic remarks. 80% of trans youth have reported feeling unsafe in their schools because of their gender. And over here, 40% of homeless youth are LGBT. The number one cause of LGBT youth homelessness is family rejection of their orientation or gender. And 54% of all cases of HIV among young people ages 13 to 24 were from male-to-male sex contact, often due to sex health programming not providing sufficient education for youth to know who are outside of the HetCisNorms that are discussed or offered, if at all, are left without education of knowing what to do. So we also see the impact of unsafe schools. So where 65% of youth have heard homophobic remarks. In schools, 30% of youth of LGBT youth have missed at least one day of school in the past month because of feeling unsafe or uncomfortable. And 85% of LGBT youth have been verbally harassed over the past year. So then when we think of minority stress theory and we think of the stressors and how there can be protective factors that can mitigate outcomes, let's think about what are the problematic outcomes. So when LGBT youth are exposed to additional stressors, we see that they are especially vulnerable to mental health concerns, such as inclusive of physical and sexual exploitation, substance use, and suicide. We see that suicide is the second leading cause of death for young people ages 10 to 24, where LGBTQ youth are 14 times more likely at higher risk of suicide than their straight cisgender peers. And we talk about that this is due to the stigma, those culture-specific stressors that make it so difficult and cause such harmful outcomes, such as anxiety or depression. We see that 77% of transgender youth seriously considered suicide and 45% actually attempted. The good news is, so talking about the protective factors, when youth have access to a supportive family environment, their susceptibility to suicide decreases by 93%. That's big for those protective factors. So then when we think about the impact of school climates for LGBT students. So when there are more problematic, unsafe climates for students in schools, we see that LGBT students tend to have lower GPAs, or grade point averages, that they demonstrate a lower likeliness of wanting to go to college, and that their self-esteem decreases. We also see, as far as outcomes, that LGBT youth endorse at greater rates than their cisgender peers a lack of safety. For their mental health, they endorse increased rates of depressive symptoms, self-harm, suicidal ideation, and attempts, and PTSD, post-traumatic stress disorder prevalence. There are increased at-risk behavior engagement of increased rates of pregnancy, substance use, truancy, and weapon possession. And school-related, we see a decreased academic achievement compared to straight cisgender peers, increased rates of school dropout, lower self-esteem, lower attendance with more absences, and fewer post-secondary educational plans. So we see here that, yes, there are problematic adverse outcomes that LGBT youth experience compared to their heterosexual cisgender peers, but this is not because they're LGBT. This is because of the stress they experience, which then exhausts resources and leads to exacerbated outcomes. And these stressors are induced because of the HetCisNorms to which our youth are exposed.